But wanted to ask, in the treatment of mental illness, medications certainly have been important. Behavioral psychotherapy has been important, counseling, and so forth and so on. In fact, there's historically been a debate about sort of the relative value of medications versus counseling and such. Curious as to if in any of the work that Genomind has done in sort of the development or any of the studies, there's been sort of, any comment on sort of how the behavioral or counseling side sort of does or does not sort of integrate now with a better targeted treatment, first. Is there any connection there?
I would say that that's a great question. Our competitor, which was called Assurex, they're now owned by Myriad. They just released a study of their product, which is similar to ours, where they did show an improvement in patient outcome. So these are patients under treatment but got on the right medication, and I think to your point, there have been some people out there who have criticized the use of antidepressants. However, there was another study that was just released within the last month that again showed that the antidepressants do work on people. I think though, much like we talked about a little earlier, if we get people on the right medication and they adhere to the regimen, you do see an improvement. But with mental illness, what we find in what we see, and again, I'm an accountant, so this is a little out of my wheelhouse, is everyone's different. And that's why you need a professional, such as a psychiatrist, to understand that specific person's situation, what some of the comorbidities may be, and they make the determination what medicine, if any, is necessary, along with other forms of treatment. So it's sort of a bag of options, and our goal again is rather than just take a medication, assume it's going to work. Why don't we use our test, genetic test, as a guide to get you on the right medication and in the right dose? Because some people do metabolize anything they consume either too quickly or too slowly. So that is also part of the genetic test.
That does, you're able to help with that in terms of the tested results as well.
Metabolism, sure.
Yeah. You talked a moment ago about psychiatry, versus primary care, essentially. And, I think there's been a push, as I understand it, over the years to really try to do a better job in primary care, screening for and identifying for mental conditions or substance abuse. And, ironically, maybe not surprisingly, it's something that a lot of primary care physicians have not been trained to do. And also, it's a touchy subject. Sometimes we avoid, sort of talking about mental health conditions, and there's a stigma associated with it. But I'm wondering, as you see the world evolve, do you see this moving into potentially primary care at the advice of psychiatry?
Yeah, absolutely. That is certainly the goal. And again, as you pointed out, we'll talk more about the venture capital aspect, but that does drive our behavior as a company. We'd love to get to every family doctor out there and as a call point, but you have a X number of dollars to spend. But I do see that certainly with social media and doctors, getting their continuing medical education credits, they're becoming more aware of it. And I know even when I go in for my annual physical, that is certainly one of the questions they're asking me, because people in that, say, 50 to 60 age group, especially males, depression is fairly common. So they do ask that question in the annual exam, which I think is great. Because to me, as we all want, and always suggest we should all have a good relationship with a family doctor. And when you see them, annually, I think that allows for that relationship to build, so the doctor knows whether you're, the same old Tom or Dennis, or something has changed. And as we all know, we go through different phases of our lives. So that's what's interesting with mental health. You may be great for some period of time, and all of a sudden, I think it's 1 in 5 people will have some type of depression in their lifetime.
Yeah.